While the COVID death numbers took a hit, vaccine efforts in Ohio received a booster shot this week as the new Johnson & Johnson vaccine was released, starting in Ohio. And that is allowing the state to catch up with the healthcare workers, nursing home residents and staff, people over 65, and school employees who've been eligible for shots until this week. Statehouse correspondent Jo Ingles takes a look at how the vaccine effort in Ohio is progressing.
And what puts us on offense really is having the vaccine. We have more vaccine coming into the state of Ohio.
Ohio got more than 96,000 doses of the new Johnson & Johnson vaccine this past week. And the first person to get it in the U.S. was an 86-year-old woman who got her shot at a clinic inside the Schottenstein Arena at Ohio State Tuesday.
This is by far the most doses, more doses than we received in any other week. We're very excited about this.
The J&J vaccine was sent to about 200 independent pharmacies that hadn't yet been able to participate in the vaccine effort, as well as existing providers. And with the Pfizer and Moderna shipments, Ohio got nearly 500,000 doses this week. DeWine says 1,200 providers that are now online had vaccine available throughout the state. So he took an anxiously awaited step. The list of eligible medical conditions in the 1C group was expanded to 246,000 more people, including those with type 1 diabetes, those who are pregnant, and people who have had organ transplants. Also in 1C, people with high-risk jobs, including funeral service directors, daycare providers, and security forces that work at least 20 hours a week. Full-time officers with state and local police and corrections officers who have been lobbying for the vaccines for months are also included in this category. And after about a month of eligibility only for those over 65, DeWine dropped the age to 60.
Age is going to continue to be our dominant indicator. We know that if when we get down to 50, we're going to be at 97 or 98% of all the deaths have been people over 50. So age is really the best indicator. We're balancing these things and trying to assess where the risk is. We're trying to make sure we understand the best we can where the risk is. And so as you saw what we did today, we lowered the age down to 60.
This adds 941,000 people to the vaccine eligibility list. DeWine says the next group will be 55 to 59-year-olds, but he's not saying when that window will open. And some medical conditions are still left off the list, most notably cancer. And many workers who were considered essential, such as those working in restaurants or grocery stores, haven't been given priority yet either. Some younger Ohioans have gotten shots by showing up to fill canceled or no-show appointments. DeWine says providers are supposed to follow a protocol for dispensing those extra shots.
What we have said is that first of all, you should try to estimate the best you can. Second, if you have something left over and you cannot keep it, to follow the regulations, you obviously have to follow the regulations. What we're saying to them is you should have, when you start that day, a list of people you're going to go to. And I know that a number of them do have a list. And we've asked them to get that list from people who are in the eligible group.
DeWine says if no one from the eligible list is available, providers can give shots to non-eligible Ohioans. But he says the shots, which have to be used quickly to avoid expiration, should not be wasted. Unused shots have to be reported to the state health department. About 300 vaccines have gone unused in Ohio so far, and that's around 1%. Some are due to waste, but most are due to other issues. For many, scheduling is still a challenge, since it's unknown when the state's centralized system will be online. Eligible Ohioans need to call or register online with any of the 1,500 providers who have the vaccine in their area, And many people are finding they need to travel to other counties to get their shots. DeWine says Ohioans should expect mass vaccination clinics in the near future. And President Biden is saying that everyone who wants a shot should be able to get one by the end of May. The state is working on making sure vaccine distribution efforts are equitable and is trying to discourage vaccine hesitancy with outreach efforts in town halls for African Americans, Hispanics, Asian Americans, Pacific Islanders, and rural Ohioans. Jo Ingles, Statehouse News Bureau.